Hello, I'm Dr. J, and I'm here today to talk to you about posture. We know when we have defective postures or postures that are not so right, people tend to have increased stress levels, decreased energy levels on a daily basis, and an inability to imbibe good oxygen into their lungs, just to name a few things. Typically, also people, when they have poor posture, they find that they have more neck pain, mid-back pain. Sometimes a person could have, this could lead into things like pain down one arm or both arms, and an increase in frequency and severity of headaches. Okay, so over here we have Chrissy. She's our volunteer today. We're gonna take a look at her posture from head to toe in a detailed way. So we're gonna start right here. You're gonna notice from your perspective is that her chin line is actually lower on her right-hand side. So there's a slant, her chin line is lower on the right-hand side. Also too as well, if you look closely, this might be a little more difficult for you to reveal, but her neck actually has a convexity with like kind of like the peak of the curvature onto the left side right here, okay? Now if we look down to her shoulders right here, you can see that the right shoulder is significantly higher than the left. Now we're moving down to the thorax, the chest area right here. I mean, these are parts of people's posture that we don't normally look at, but we can see here she has a lateral translation, so her thorax, her chest is laterally going out to her left, and her pelvis, as you can see here, is going way out to the right. And this is not just a little bit, guys, this is a whole lot. Also, if you look a little bit more closely too as well, you're gonna see a gap underneath her arm on the left-hand side, where you don't on the right-hand side. And then what that is, that's a function of her thorax, her chest going to the left, and her pelvis going to the right. Hopefully that makes sense to everybody. You can see how that gap opens up here. Now, if you look a little more closely at her pelvis, you can see it's quite a bit dropped on the left-hand side versus the right. And her knees buckle inwards too as well slightly, okay? Also too as well, you're gonna notice, and we bring Chrissy to the side, so we're gonna turn Chrissy to the side like this. It's gonna be a little harder for you guys to tell right here, but she actually has got a reverse curve in her neck, okay? It's a little bit difficult for you to see, but we revealed this on spinal x-rays and radiographs. So Chrissy, come on down, face down on the table, nose right in through here, perfect. And what we're gonna attempt to do is reverse everything that you just seen, or most of what you've seen, okay? So using gentle adjustments that don't hurt. Chrissy's been adjusted many times before. And what we're gonna do is we're just gonna start at the bottom. Some of these tables are made with these little drop pieces right here, which can help and aid in the adjustment. In this case today, we're really focusing on posture, okay? Yep, and it's got gentle little drops. Okay, so what we're doing here, we're attempting to do here, everybody, with these table drops, is when we saw the translation in your pelvis, so her upper body was going to the left, and her lower body, her pelvis was going to her right, we're gonna go in the reverse position here. So this is where the table pieces can be really helpful in chiropractic here. Okay, so I'm just gonna tinker with them a little bit here. So what I'm gonna do is, and one more time. And now what we're gonna do is we're gonna go up to her neck area where we identified that she has a convexity of her neck to the left-hand side. We're simply gonna go in the opposite direction. So again, I'm gonna use the aid of the table right here. And here we go. And we're gonna come back to midline. That's great. Now I'm gonna ask Chrissy, I'm gonna get you lying on your right-hand side facing me, Chrissy, okay? Kind of in fetal position. Perfect, I'm gonna bring this knee up, and we're gonna bring you to the edge. And I'm gonna come right in here. Now this is a manual adjustment, and again, what we're trying to do is not only align the spine, but our objective is to improve her posture. Just a gentle release there, and now to the other side. And how this feels for Chrissy as the patient, she should be very comfortable. There's absolutely no pain or discomfort. And on your back, and everything should be very gentle. All right, so what we're gonna do here now is we're going to continue to adjust Chrissy's thorax. So I'm just gonna come gently up underneath here, placing my hand. Nice deep breath in and out, yeah. Now what we notice with Chrissy's upper spine, she has a little bit of a kyphotic spine, okay, a little bit of a hunch. So what we're doing there is a correction for that, okay? And that will help her breathe with more ease, okay? And you can relax your arms now. I'm just gonna lift this. Now we're gonna come into the neck area here. We're just gonna do a gentle, gentle adjustment here. And identifying where to adjust, palpating with my fingertips, which segments need to be adjusted. What we're adjusting here at the top of the spine is we're also working with, talking about posture here today, guys, is that we identified that she's got a convexity in her neck to the left, okay? So we're attempting to take that convexity out of her neck, okay? So she has straight, aligned posture. Okay, and now we're gonna bring Chrissy up. Let me help you up. Fantastic. We're gonna stand you right over here, Chrissy. Fantastic, and we're gonna take a look at your posture now, okay? So what we're seeing here, we should see the chin line definitely a little bit more leveled out now, everybody. Not as much tilted into the left-hand side. The convexity that we identified right here on the left side of the neck should be definitely straighter. Her shoulder level is definitely a lot more level now. It's not perfect, ideal, but it's getting better. Have you noticed too as well, the gap underneath her arm on the left-hand side, there's less of a gap, which means that there's less translation of the spine, okay? Lateral translation of the upper body relative to the pelvis, okay? So it's a little bit more aligned through here. And then definitely the pelvis too as well is improved too as well as far as the decreased or the lowering of the pelvis that you see from your perspective on the left-hand side. And that is fantastic. Thank you for helping us out, Chrissy. Well, that's it for posture today. Be sure to check out our other health tip videos, and I hope you enjoyed today's experience. Get well and stay well. Thank you.